Should we? Good morning, everybody. We're very happy you could join us for our Immigration Spotlight. We're going to begin with Sally with a prayer.
Hey, thank you, Mary Jane. This prayer is actually, it's called a blessing. It's a blessing for the place between. When you come to the place between, when you have left what you held most dear, when you are traveling toward the life you know not, when you arrive at the hardest ground, may it become for you a place to rest. May it become for you a place to dream. May the pain that has pressed itself into you give way to vision, to knowing. May the morning make of it an altar, a path, a place to begin again. Amen.
Amen. Thank you, Sally. This morning, we are happy to have Bob Key with us. Bob is what we're calling our Loretto representative in the Nogales, Sonora, the Sonoran Desert, the migrants in Tucson, and the detention center. Bob will speak first, and then if you have questions, hold your questions. Then Sara Soto will join us. She is one of the founders of Espacio Migrante, and she is also the financial director. She does not have a camera on her computer. It's a little bit old, she said. And the chief organizer, Catherine Giron. And Sara will be translating for Catherine. Catherine is from El Salvador, and she is the lead organizer for Spanish-speaking migrants. And they will give us an update on what is happening in Tijuana. So let's just begin, and Bob, take it away.
Okay, well, it's so nice to see everybody after. I haven't seen folks in a while, so it's so good to see you all. And thanks for the invitation, as always. So just to give you a sense of what's going on here at the border in Nogales and then in the desert as well. So yesterday I was in the desert. It was actually a pretty quiet day yesterday. We toured the wall and then drove up into the desert, checking some of our water drops, food drops. And we're seeing activity out in the desert. So people are still crossing, and I know that from speaking with people in Nogales as well. So, and it's really getting hot today. It's gonna be 90 degrees and tomorrow mid 90s. So it's not good to be out there right now. So as far as Nogales is concerned, MPP, the stay in Mexico, is still in place in Nogales. People are not permitted to apply for asylum and cross at that port of entry. And who knows, the lawyers at the Florence Project, they say they have no idea when this may change or what's going to happen with the stay in Mexico as far as Nogales is concerned. So at the Comodore, where I volunteer, lots of women and children right now. A lot of people from Guatemala and Honduras. And I've spoken with some that have been there a year and a half, close to 2 years, waiting in Nogales. And it's so hard because the living situations are difficult. you've got people living in shelters. Some are living in hotel rooms, sharing rooms with others, and some are fortunate enough to have a house, small house, where they can share with people. Some that have families here in the U.S. are fortunate enough to get money from those families, so they're able to their living conditions are a little bit better than living in the shelter, which is horrible. But fortunately, I have not seen any cases of COVID or talked to people that have had COVID. So who knows how people are escaping that, but fortunately they are, which is a great thing. But some of the people, can't continue to wait, and some have decided to cross in the desert. And many have been apprehended. And what's happening is at the border, there's what's called Title 42. So if they're apprehended in the desert, they'll ship them right back to the border. And it doesn't really matter if you're from Mexico or Guatemala or Honduras. They'll just ship you back and drop you off across the border. And so we're seeing all of these border towns, kind of explode with people. And their sad thing is they're dropping off people in bus loads in the middle of the night, between midnight and 6 a.m., which they're not supposed to be doing. So fortunately, like in Douglas, where they're doing this, people are meeting them at the buses so that they, because otherwise there'd be an extreme danger of the cartels, because the cartels control all of these towns. And I mean, I hear some really sad stories of these people having to wait. I talked with a couple of people, a young woman, and a young man, both who had children, and they told me that they had actually even thought of going to the border and leaving their children in the US so that the children could get picked up. And it made me so angry, just that these people even had to entertain this idea of separating themselves from their children. And they decided, I can't do this. So they, obviously they didn't. And one thing I did discover is that unaccompanied Mexican children, for the most part, are sent right back to Mexico. They're not like children from South America or Ecuador, other places, are permitted to stay in the US, and then we'll search for their families. But if they're from Mexico, chances are they're going to send them back to Mexico, and DEEF, which is a government organization in Mexico, will take care of them, hopefully in Mexico. And actually just discovered that recently they set up a big tent, or a couple tents, here in Tucson for unaccompanied minors and families. And they say they're able to accommodate about 200 people, 200. And most of these are supposed to be unaccompanied minors, but it's just starting to open up. And one of the things I did discover by talking to many of these people is that several of them have children, US children, in the United States. The parent has been deported back to Mexico, but their children are still in the US, but they're minor children, so they're not able to bring their parents. So we've got a lot of separation of families going on. And one really good thing is that at the Comodore now, the Florence Project, which is a group of lawyers that represents asylum seekers pro bono, they have a presence at the Comodore 7 days a week. So everybody that comes into the Comodore for assistance is able to speak with a lawyer to talk about their case. And even though the port of entry is closed in Nogales, when I was there on Monday, before I left, this young mother from Guatemala who has two children. One, her young daughter is about 6. She has cerebral palsy. And she told me, she said, she asked, when are you coming back? And I said, I'll be back on Monday. And she said, oh, I'm sorry to hear that. And I said, well, why? She said, because I'm being allowed to cross in Nogales, which is, and I asked one of the sisters, why is this? And she said, I have no idea. So there's a lot of things that go on that don't follow policy. But, you know, so of course I was very, very happy for her because she's going to go to North Carolina to be with her sister. So, and then tomorrow I'm heading back down to Mexico, to a town of Sasabe, which is a really, really small town. I mean, it's really small, and it's a place where a lot of people get deported back to, and they have no resources. So they're starting to set up a resource center in Sasabe tomorrow. So I want to go down and kind of find out what's going on down there, and how all of that's going to work, and because I know they're going to need assistance down there for stuff. So, but yeah, that's about all that's. Oh, and as far as talking about the Freedom Fund, which is the fund that permits us to help people raise money for bonds or to have money for lawyers. I just got a call the other day from a woman from another organization, and she needed some extra money to bond out a woman who was in Louisiana, who started out in Eloy, and they moved her to Mississippi and then to Louisiana. And these are steps that mean that these people are on their way back to being deported. So her bond, fortunately, was low, $7,000. So she reached out to a few different groups, and we were able to get the $7,000 for her to get her bonded out. But there's another woman that's her bond was $20,000. So it was something that we couldn't do. So any money that goes into the bond fund, it's nice to have that money there and have it accessible for situations like this. So thank you all for contributions and support. So that's, yeah. And any questions I'll entertain later for sure. Thank you so much.
Okay, thanks, Bob. Sara, you're on. We won't see Sara, but we can hear her.
Hi, good morning, all. Yes, I don't have a webcam. I'm sorry. Well, as Mary Jean said, I'm the co-founder and financial director from Espacio Migrante. So, well, what is happening right now in the border is that, same as Bob said, a lot of there's no only MPP cases are being processed right now. There's no and some cases that are not MPP are cases with where people are in extreme danger here in Tijuana, and they cannot be at the border waiting to get the asylum here. So and when they have very difficult health conditions that they are not related to COVID. But yes, right now what we are doing is providing information for people who are trying to seek asylum in the US, maybe people who are in the list, some people under MPP that their case were closed because they didn't attend a hearing or something like that. And people who came to Tijuana during the pandemic or after the pandemic, and the list were, I don't know if you heard about the Medellin list. It's a list where people used to write their name and get a number to be able to have this interview with CBP at the border. And then CBP decided either going to wait in the US or in Mexico with MPP. But yeah, basically that's what is happening right now. We are providing information through Zoom. We are doing these informative sessions through Zoom with English, Creole, French interpretation as well, and with the help of some U.S. Migration attorneys. They are all volunteers, and yes, basically they provide information and they answer some questions that people might have. Um, we don't in these sessions, because they're open and it's public. They don't get to talk about their personal cases because that might put them in danger. So there's the attorneys only answer general questions about what is happening right now at the border, what is MPP, what they have to do if they are not on the list, or they just got in Tijuana, and also about some resources here in Tijuana, such as shelters, other organizations that may be able to help them depending maybe health issues, or um, uh, the contact with the al otro lado attorneys, etc. And and also we are trying, we are working with the communities, and this is the Catherine's job, um, because we have a shelter, so we are providing a shelter space for people in the shelter, with food, legal assistance, mental health aid, and a lot of other activities. But um, but we also working with the migrant community living in Tijuana, that they are not in a shelter. So we are looking funds for buying these food carts where they can go to a supermarket and get food. And we also are trying to get some funds, because some of them, they are not able to pay the rent because with the pandemic, they lose their job. So we are trying to help them with rent, and in some cases with some specific um, health, maybe medicines, or if they have a specific health condition, we're trying to help them with medicines, or some, I don't know, some tests that they might need. And we also, well, we are working in general with the migrant community living outside of the shelters and living in Tijuana. And for example, we have this case where a man from Venezuela, he's very sick. He got prostate cancer, and he has some condition in his kidney. So he has to travel to Colombia to get an operation, and we pay him the flight, and because he doesn't have the money, we provide him, we provide some money for him to buy, I don't know, something that he will need in the during the travel to Colombia. So that's what we are doing right now. In the community center right now, it's closed, but Catherine and the African community organizer, she both of them are very close to the migrant community living in Tijuana. And we are about to hire a Haitian community organizer. We thought that we found one, but she just she's now in Florida, so we have to find a new one. And but yes, and Catherine can talk a little more about what she does in the community organizer position, and maybe tell us about what is right now she's doing in Tijuana as well. But first, do you have a question about what is going on in Tijuana? Okay. Bob?
Who are the people that you are seeing in Tijuana? What countries are they coming from?
Well, Central American countries such as Honduras, Guatemala, El Salvador, but we have seen people from Venezuela, from Nicaragua, from Africa, such as Ghana, Cameroon, other Cote d'Ivoire, and a lot of African countries as well. And also we have seen a lot of Mexicans from Guerrero and Michoacan, mostly, that they are trying to get asylum in the US because of the narco in those regions is that the situation is very unsecure and dangerous.
My other question is, do you have a sense of how many people are crossing daily for asylum, or does that number vary?
No, we don't know yet how many people are crossing every day. We know that sometimes is like a huge, like a bunch. Let me ask Catherine, but I think we don't know. We don't have a number. Katy, ¿tú sabes cuántos cruzan diario o cuántos les hablan para que crucen?
Al principio eran 25 personas, pero ese número fue aumentando. Sí anda a menos de 100 personas, pero más o menos
Oh,
unos
okay.
50, 70 personas.
Yeah, we don't have a number exactly, but Katy said that at first only 25 people were processed, but now it's around less than 100, like about 50 or I don't know, but more than 25, less than 100.
Thank you.
Sara,
Thank you.
maybe Catherine could talk and then we can entertain questions from everybody.
Okay. Katy, puedes empezar. Katy va a hablar en español. I'm sorry. Katy will speak in Spanish and I will translate, do the interpretation in Spanish. In English, I'm sorry.
Ok, muchas gracias. Bueno, es un placer para mí estar con ustedes. Mi nombre es Catherine, soy de El Salvador y pues tengo casi 4 años viviendo aquí en Tijuana. Bueno, en México, tengo en Tijuana apenas 2 años y cachito. Bueno, mi trabajo con Espacio Migrante comenzó hace 1 año, 1 mes. Empecé con la comunidad migrante. La idea es que mi trabajo es con el vínculo con la comunidad fuera de los albergues. No sé, Sara, si quieres ir traduciendo o cómo funciona.
Sí, está bien. She said, hi everybody, my name is Catherine, I'm from El Salvador. I've been living in Mexico for 4 years now, but in Tijuana, I've been living 2 years. And I've been working with Espacio Migrante for a year. And my work is with the Hispanic migrant community living in Tijuana.
Bueno, la verdad es que nosotros estamos todo el tiempo hablando con la comunidad. Bueno, mi trabajo es más que todo escuchar algunas situaciones que tiene la comunidad fuera de los albergues, ya que consideramos que es mucho. De hecho, me atrevería a decir que hay muchísimas más personas fuera de albergues que la que viven en ellos. Muchas personas ya están viviendo en Tijuana hace un tiempo, desde que, bueno, llegaron a México, pero en su mayoría son personas que vinieron a Tijuana cuando la frontera ya estaba cerrada. Y pues últimamente cuando comenzaron a cruzar los MPP, ese número aumentó. Como bien dice Sara, en su mayoría son mexicanos de estados como Guerrero y Michoacán, pero también hay muchísimas personas de otros países.
So she said that basically her job is to listen about the situation with these people living outside of the shelters. She said that she thinks that there's more people living outside of the shelters than living in the shelters. and she sees a big need in these communities because a lot of people are arriving to Tijuana since the pandemic started, so the border was closed, and they couldn't like they don't know exactly what is going on with them because the border is closed, so everything stopped. But when the pandemic started, and I think that's all.
Ok, bueno, como decía, nosotros estamos hablando con la comunidad, perdón, muchos de esos problemas es en cuestiones, pues, como trabajo o acceder a sus derechos. Entonces, nosotros estamos ahí para ser como ese apoyo y la organización tiene ciertos proyectos o, o talleres que pueden ayudarles como a conocer esos derechos. Por ejemplo, hay niños que quieren entrar a la escuela y no conocen sobre cómo es el proceso, por lo mismo que ya tienen mucho tiempo acá, entonces quieren buscar la opción de que sus niños entren a la escuela, pero sobre todo es la necesidad, la cual es muy grande. Hay mucha gente que se acerca a diario a pedirnos apoyo económico con comida, con algunos pagos de renta, porque no tienen documentos, ya que también no están renovando documentos acá, no hay ninguna forma de poder acceder pues a trabajo. Entonces, la situación económica para los migrantes fue mucho más dura durante la pandemia.
Okay, I forgot to say something that Kathy mentioned, is that she has seen a lot of Mexicans, as I told you before, that they are from mostly Guerrero and Michoacan, and in this migrant community living in Tijuana. And she said that she talks to the Hispanic community living in Tijuana and about some process. For example, maybe they want to enroll their kids to school and they don't know that the kids have access to the school, to the education. And with the help of Kathy and in Tania, which is our in Espacio Migrante, they help them to enroll their children to the school. And ¿qué fue lo último que dijiste, Katy?
Que mencionaba las necesidades que tiene la comunidad desde que empezó la pandemia, que no tienen documentos.
So yeah, so she said that the needs that the migrant community have in Tijuana are related to mostly economic needs. For example, and since the pandemic started, it got worse for the migrant community living in Tijuana, because if they didn't have access before to the to work and proper documentation to have a formal job here in Tijuana, with the pandemic, a lot of places shut down and a lot of people lost their job here in Tijuana, and mostly the smallest businesses that are the ones that hire migrant people, because they don't require like a residency here in Mexico. And because they don't have access to a job, they don't have money, they cannot pay rent, and a lot of people goes to Espacio Migrante and ask for help. It could be for food, for rent, and for health issues as well. So yes, that's what the needs that Kathy has seen talking to the community, because I forgot to mention she's in direct contact with this community, so she gets to talk with the people all the time by the phone.
Sí, como mencionaba Sara, tenemos un número que es especial para comunidades, el cual todo el tiempo estamos compartiendo. Entonces, diario recibo alrededor de 25 mensajes nuevos de personas diciéndome, necesito que me apoyes con renta, con asistencia legal, con algún alguna tal vez medicamento o alguna necesidad. Y es ahí, nosotros no tenemos como todos los recursos exactos, como por ejemplo una clínica, pero trabajamos en conjunto con organizaciones. Entonces, por ejemplo, si alguien necesita medicina o un doctor, pues lo canalizamos con Refugee Health Alliance, que es una organización que tiene pues una clínica que es gratuita. También pues en algunas opciones como también apoyo psicológico, el cual también necesitan mucho, se canaliza con Hayas o con UNICEF o con alguna otra organización. Entonces, pues la verdad es que a mí me gusta mucho mi trabajo. Creo que algo que por lo cual estoy muy agradecida es porque yo soy migrante, soy una mujer migrante, la cual ha pasado también como situaciones muy fuertes y creo que ese trabajo con la comunidad es como una pequeña forma para mí de poder también estar allí, ¿no? En ese camino con esas personas que han vivido, que están viviendo lo que yo en un momento pasé y Espacio Migrante me abrió las puertas y confió en mí y la verdad para mí eso ha sido muy, muy especial. Me encanta mi trabajo y aunque también es muy triste pues, escuchar historias muy fuertes, pero también es para mí como una bendición, como poder estar ahí para esas personas cuando sé que también es muy necesario el apoyo.
Okay, so Kathy said that there's a special number for the community, for the communities, so people can, we are sharing this number all the time in our social media and WhatsApp groups with the migrant community. So people, if they need something, they can reach us at these numbers, and we will be in direct contact with them. And also we, for example, we are a small organization, so we don't have everything, even though we wanted to, but we can't. But we work in collaboration with a lot of organizations here in Tijuana. So for example, if they're sick and they need medical attention, we send them with the Clinic of Refugee Health Alliance that is next to Espacio Migrante, and they mostly help them with a lot of things. But when they cannot help them, we try to refer them to other organizations, health organizations, or trying to, for example, if they need something like, I don't know, maybe they have they need glasses or because they don't, yeah, they need glasses, and we try to send to refer them with other organizations that might be able to help them. And other, if for example we work with a lot of mental health organizations that provide mental health. So if they need if someone needs that, we refer them to those organizations. And Kathy said that she's really happy with her work. She said that she really loves what she does because she's a migrant woman that that know what it's like to be with this she knows what is to be a migrant in Tijuana and what kind of needs that they have. And she feels that because she knows what it is to be a migrant here in Tijuana, she's really happy to be able to help them. And she said that working in Espacio Migrante is the way that she's helping the community. And she said that Espacio Migrante opened her opened the doors for her, and she's really happy and grateful with Espacio Migrante because she feels that she's doing something for her community, and she's really, even though it's sad because there's a lot of need, there's a lot of things that we don't like to hear or see, but she's happy with the work that she's doing. And I wanted to add that we are really happy with Kathy's work as well. Gracias, Kathy. También estamos muy contentos con tu trabajo.
Kathy, how come you came from El Salvador? ¿Qué pasó allá?
Ok, bueno, la verdad es que en mi país hay mucha violencia por parte de pandillas. De hecho, bueno, yo salí justamente por eso, porque sufrí violencia de género por causa de pandillas. La verdad es que nunca pensé estar en este contexto de movilidad. En mi país teníamos pues una estabilidad económica, yo estaba en escuela, tenía una vida normal, ¿sabes? Y de la noche a la mañana me di cuenta de que estaban pasando situaciones muy difíciles con mi familia. Hubieron cosas que pasaron de violencia contra mi hermana y yo no estaba en cuenta porque estaba siendo amenazada de que no dijera nada. Entonces, de repente fue como caer en un, como de golpe, ¿no? Como que te pasan las cosas así de la nada y tú dices, ¿qué está pasando? ¿Por qué está sucediendo esto? Y luego, un día en la mañana, de repente llega mi hermana llorando y dice, tenemos que irnos porque si no, van a venir a matarnos. Y tuvimos que tomar lo que podíamos, sobre todo fue dinero y teléfono y nada más. De hecho, ni siquiera traíamos ropa, nada. Salimos de mi casa, mi papá estaba trabajando y fue, papá no llega a la casa porque pues lo puede matar, ¿no? Entonces, la verdad es que fue una situación muy fuerte para mí, jamás en mi vida me imaginé en esa posición, personas amenazando pues con armas y todo, ¿no? A nuestra seguridad fue algo muy fuerte, algo que realmente no hubiera querido pasar, no creo que nadie debería de pasar. De hecho, yo iba a la iglesia, tenía una vida, pues, desde cierto punto normal, ¿no? O feliz o tranquila. Y pues me tocó. Y la verdad es que fue muy fuerte mi camino. Viví violencia también en Guatemala por las mismas pandillas que llegaron a acribillar a balazos el hotel donde estábamos viviendo. Luego viví violencia en Tapachula y también en Ciudad de México. La verdad, yo nunca pensé estar también en Tijuana o queriendo cruzar Estados Unidos. Sara, voy a dejar
Sí.
que traduzcas, perdón.
Okay.
Nah. So she said that she never thought that she could be in this context as a migrant, and she said that in El Salvador there's a lot of violence, and that she used to have like a normal, quiet life. She was studying, their family were stable, and she used to go to church as well. And she personally suffered from gender violence. And um, she also said that her sister also suffered from violence, and Catherine didn't knew about that then, because her sister were I forgot how we pronounce threat. She was threatened. Sorry.
Threatened.
And so she couldn't say nothing because she was afraid. So she said that one day to another, everything changed for her. Her sister came crying and saying that she had to leave, because if they didn't leave, they were going to be killed or murdered by these gangs. So they took like everything that, well, not much. They took money and their phone or some documents, but they had to leave everything, clothes, furniture, everything in their house. And her father was working, and they called him and told him not to come to the house because he could be murdered or killed by these gangs if they did go to his house. So they moved to Guatemala, and in Guatemala they also suffered violence. The hotel that they were in was it was a shooting there. So they moved to Mexico and they moved to Chiapas and they also suffered violence there. They moved to Mexico City and that happens the same thing. And they moved to Tijuana after that. And she said that she never thought that she could be living in Tijuana. So that yeah, she said that she never wanted to move. They never wanted to move or leave El Salvador. They were a normal family living in El Salvador. They were stable, they were happy, and she thought that she had a good life there. But the violence made them migrate to Tijuana. So now they are in Tijuana.
Gracias.
Sí, la verdad es que fue algo muy duro para mí, todo el camino desde que salí de mi casa. Como decía, había mucha violencia y lo peor es que, bueno, en Tapachula y en Guatemala fue también las mismas pandillas, porque Tapachula y Guatemala es como El Salvador, es lo mismo. Pero estando aquí en Ciudad de México ya teníamos una vida estable, ya habíamos comprado muebles y todo, pensamos que nos íbamos a quedar ahí y estaba trabajando en una tienda cuando llegaron a asaltar una banda de criminales y pusimos una denuncia y empezaron a acosarnos y llegaron al punto de amenazarnos con armas diciendo ustedes son migrantes, ustedes no valen nada, tienen que irse y quitar esa denuncia o les matamos y nadie va a reclamar nada. Entonces,
Okay, I see. So she said that in the journey was really hard for them. The Guatemala and Chiapas is the same as El Salvador. They are the same gangs. They are really connected. They are really well organized. And in Mexico City, they thought they were making or alive. They were buying furniture and things. They thought that they were going to stay there, but she was working on a store, and then a criminal gang, I, assaulted the store. So they put ay, ¿cómo se dice denuncia? ¿Cómo se dice denuncia, Mary G?
Yeah, announcements. Está bien, Sara.
They put an announcement about the what happens. They went to the police and did this process, and she said that the gang were looking for them and threatened them that if they don't leave, they're going to be killed as well. So that's when they decided to move to Tijuana. And they decided to get to Tijuana to ask for asylum in the US because they weren't safe in Mexico.
sí, pedimos asilo en Estados Unidos, estuve un tiempo bajo el programa MPP. Estuve 8 meses asistiendo a cortes. Los casos de mi familia fueron separados por ser adultos. Yo viajé con mi familia desde El Salvador, con mi papá, mi mamá y mi hermana, pero cuando entramos a Estados Unidos separaron nuestros casos y nos dieron diferentes jueces. Entonces fue un trabajo muy grande querer unir esas cortes y al final el abogado que conseguimos teníamos que pagarle. Costaba alrededor de $500 mensuales, los cuales es imposible de pagar estando en México porque ganas pesos. Viví en el albergue Espacio Migrante por 8 meses que estuve yendo a corte y después de que estuvimos pagando y todo, mi mamá cayó muy enferma, ella perdió su visión, no podía ver, entonces tuvimos que operarla y todo el dinero que teníamos para el abogado se fue en los gastos de la operación, porque no había una fundación que nos apoyara con eso. Entonces fue una decisión quedarnos aquí porque no teníamos para pagar el abogado no podíamos unir nuestros casos y no queríamos que si alguien entrara, los demás regresaran a El Salvador, porque no podemos regresar. Y decidí quedarme en México y hasta ahorita puedo decir que fue la mejor decisión que he tomado.
Okay, she said that they were seeking asylum in the US, but when they as a family they were seeking asylum all together. But when they arrived to Tijuana and they tried to do that, they separate the cases, so they give them different judge for one of them, for each of them. So it was really complicated. They were working with an attorney, but he was charging them $500 per month. And in Tijuana, it's really hard to get that amount of money, especially if you don't have papers or you don't have a visa to work. And it's in Mexico, the salary is very low. So it's really hard to get. $500 are around 10,000 pesos. So it's almost it's really hard to earn that amount of money, especially as a migrant. And so it was really hard for them to save the money. And she lived in Espacio Migrante with her family in the shelter of Espacio Migrante with her family for 8 months. And they were going, and she and their family were also were an MPP family as well, living in the shelter. So they were going to courts from time to time. And ¿qué más dijiste? Oh yeah, and her family, her mother got sick, very, very sick, because of the stress and everything that was happening to the family, and she lost her vision, so she had to operate him. And yeah, all the money that they were saving for the attorney, they spent it on the operation. So because there's no we don't have these foundations like where they operate this kind of cases, so they had to spend all the money on that. And that's when they decided to stay in Mexico, like drop the case in the US because it was too complicated. They couldn't have one case. They had 4 different cases, and it was really hard for them, and they wanted to stay together. So they decided to drop the case in the US, and they apply for the refugee status here in Mexico. And she said that even though they never thought to stay in Tijuana, she thinks now that that's the best decision that they made.
Sara, maybe now if anyone has questions for Bob or Patty or Sara, raise your hand or somebody will see you.
Mary Jean, this is Mariela.
Uh-huh.
Can
Oh,
you-
Mariela. Uh-huh. Welcome.
Good morning. Thank you so much for putting together this amazing, presentation. And also, I love to see all of you. I'm not going to name any because they will be, upset if I don't name them. But I have a question for 3 of you, since I'm in Louisville and I work for human trafficking prevention. Beside this, what is the main issues needed for all of you? Volunteers, medical assistants, mental, psychological issues, money, clothing. How our community, I'm talking about in Louisville, in Kentucky, I mean, if I did it for, other countries, and I know it's harder, but I do not know what are the regulations if, we bring a lot of these things for these two places, in what way we can do it, what are the regulations for all of us, and what happens if I can put together with my husband work at the university, if we can pull a group of, as I said, physicians or healthcare workers, to go for, I don't know, for a couple of days and seeing what way we can do it, like once a month or every 2 months. And if you can help me with some of these ideas, what do you think, in what way we could help? Besides, money, I think money is maybe much easier to ask. But what I'm saying is, do you need volunteers? All these things. Thank you so much.
Sara?
I think Bob raised his hand, so I
Okay.
don't know.
Bob?
But Bob is muted.
Where is Bob? Bob? Bob?
We're having trouble. We need volunteers at the Comedor, medical volunteers, because we're having trouble getting doctors and nurses to Nogales to help out. The structure is good. The structure that's in place is good. We just need people. So.
Okay, Bob, tell them where El Comedor is.
Okay, so the Comedor is in Nogales, Sonora. It's maybe a third of a mile from the border, and it's a huge building right now, but it's not open to the migrants aren't able to stay there right now because of COVID, and slowly that's going to happen. So like the Espacio Migrante, there's a psychologist, there are the lawyers, we provide medical care, the social worker that helps people work within the community. So those things are in place, but medical volunteers, we're in dire need of medical volunteers, which would be great to have volunteers.
Bob, can I ask you something? Nice to see you. I'm Mariella. I don't know if you remember me.
I do.
had the privilege, to cross with you the border and go and with the other, friends.
Yeah.
The question is, when you say that they need a lot of, some of the volunteers, I mean, did you say something about the Comedor is closed now? I mean, this is for someplace else? Or?
It's closed as far as the shelter is concerned.
Okay.
It's different, Mariela. It's the new building has opened, but it's closed because of COVID.
Okay.
So they still provide daily food, and they provide, people come in for medical services. People come in for to see the psychologists, to see the lawyers. But
Okay.
as far as the shelter is concerned, it's not open. So
I have another question regarding if I go and talk to the dean of medical school at university through my husband, is any way I can have kind of a letter where you can explain the needs of, and then I can address in a meeting to her. She is the dean of medical school here, and seeing what way maybe we can have some volunteers through the university. But I need to have something formal to address this issue. Thank you.
okay, I have a suggestion. Is that perhaps what we can do is you and I can stay in contact, but what we can do is I can connect with the volunteer coordinator at KBI and to do a Zoom call with your group.
Perfect.
And then she can explain everything, the process as to how to go about becoming a volunteer, what's needed, because we're all vetted through
Very good.
like diocese here.
Okay, then I will be in contact maybe with Mary Jean and provide, the information. Thank you, Bob. Thank you. Thank you.
I'll get in touch.
And I wanted to add, if I can, if I may, that also, for example, in Tijuana, what we need and this need of U.S. Lawyers, migration lawyers, for as volunteers to provide information, because we are not U.S. migration lawyers. So for us, even when we can tell them about what is going on, we cannot resolve some or solve some doubts or specific questions about their cases. So that's what we need right now, a lot of U.S. migration lawyers that can come and provide information, or maybe for the sessions that are online. Also, we can use that because we are providing these informative sessions through Zoom. And also mental health aid, but there's a lot of need. There's a lot of people, and there's a lot of depression and anxiety because of that is happening right now. And also, for example, like also like food, food for the people who are not living in the shelters, hygiene products, and also this, for example, face mask for and like alcohol or sanitizer because of the pandemic situation.
Sarah, I have a question for you, and I'm very sorry, but thank you so much for everything you are doing. And then same as Kathy, my daughter, she's a lawyer, and she is working in an Engage in the division of immigration and Engage. I think, I don't know what is the name, but they have a lot of Zoom information about what's going on now. I mean, everything changed since the new administration. And then I'm going to check with her if she can have a kind of maybe a conversation, what are exactly what they need, and maybe they can pull a couple of lawyers who are working and not with the government, because that's, the government, it doesn't allow to do this kind of things, but all what is the law, the things people ask, maybe she can give me some information, and then I can see in what way. Also with the immigration department in the Brandeis Law School here in Louisville, we have a very good connections, and then I will see in what way maybe somebody from there can get in contact with you and give you some of the advices, and then see if the School of Law can provide exactly the same, some kind of, advices or, whatever, and, to try to help you with all these questions. Thank you.
I have
Thank
a
you.
quick question
That would
for,
be great.
Good.
I have a quick question for Bob. Bob, if volunteers were to come to provide medical services at El Comedor,
Yeah.
where would they stay? Do you help them with accommodations, or how does that work?
No, I don't know. Yeah, I'm just a volunteer.
How about
Yeah.
KBI? Do they help?
They do work with long-term volunteers. I know that they have an apartment in Sonora that if someone, I don't know the length of volunteering, if it's a year or a matter of months, but I'm sure they could provide suggestions for people to maybe, if they want to stay in Nogales, Arizona, and can cross daily. It's easy to cross through the border. It's very simple.
Okay, thank you.
Easy to walk, yeah. So they would help them with that, sure.
Any other questions? Oh, Stacy, you had a question for Bob? Is Stacy still on?
Yeah, thanks, Mary Jane. I put it in the chat, but Bob, when you were talking about going down to Sasabe, I was just wondering if there were any specific organizations or needs if we wanted to somehow contribute there.
Yeah, I'll find out more tomorrow, specifics, but I know that people, over time have been contributing food and clothing and things like that, for the migrants that get sent back. I know backpacks or something that they'll need. Of course, money's always good, because then the people that are working can purchase whatever they need as needed, because needs change from time to time. But yeah, I'll find out more specifics tomorrow, and then share that. And so if people want to contribute to that, that would be fantastic. Yeah.
Thanks so much.
Yeah, thank you. Thank you.
Speaking of money, I'd like to tell you all that we heard just yesterday that a request that we sent into the Hunger Fund to support the food cards that Sarah mentioned that Espacio Migrante hands out to people. We heard yesterday that the Hunger Fund is going to contribute $1,000 to that effort. Yay.
Thank you.
Uh,
Thank you very much.
Any other questions? Our time is almost up, right? Or it is up.
Yeah.
It is.
Let me ask you this. If we have some, contribution, what is your advice or the advice of, Loretto, maybe to send the money to the hunger and then the money goes from there too?
Mariela, why don't we talk about that?
Perfect.
Okay.
Thank you. Thank you.
Yeah. And because LACC can get the money to where you want it to go, for sure. Okay. Any other questions or anything? I want to thank you all. Thank you so much, Bob, Sarah, and Catherine. Good job. And thank you all for joining us today.
Thank you. Thank you for the opportunity, and thank you for willing to listen what we do.
No,
Okay.
Before we all go, if anyone wants to hang around, Molly, aren't you arranging for our next Immigration Spotlight?
Hear me?
Yes, is that happening?
Oh, good. Yes, I thought my microphone was broken.
Yeah. Why don't
yes.
you give us a preview?
So I will be doing that presentation in 2 weeks with my colleague, Michaela, who we both work at Kids in Need of Defense, KIND, which is a legal organization that assists unaccompanied minors. Michaela just came back from the border a few weeks ago, but I don't know how much of that she's allowed to talk about. So we're probably going to focus more on the detention center that's in New York City. That's a 900-bed facility for unaccompanied minors coming to New York, and give a little overview of what happens to those kids from the time they cross the border to when they're placed with their sponsors.
Good, thank you. Okay.
Sure.
Okay.
Thank you all.
Thank you all.
Thank you. Bye-bye.
Bye.
Everybody.
Bye.
Bye.
Thank you. Great program.
Oh, stop recording.